Let us discuss about type 2 hypersensitivity reaction. In the last lecture, we discussed about type 1 hypersensitivity reaction. In this lecture, we will focus on type 2 hypersensitivity reaction. You see, in type 2 hypersensitivity reaction, what happens is the antigens are present in this. These antigens are present on the surface of cells. Okay, this is antigen. This antigen is present on the surface of cell. Or antigens are present in the extracellular matrix. Okay, against this antigen, antibodies are formed. Okay, antibodies are formed against the antigen that are present on the surface of cells or in the extracellular matrix. Okay, the definition is this reaction takes place when antibodies are formed against against endogenous or exogenous antigens, endogenous or exogenous antigens present on the surface of cells, present on the surface of cells or in the extracellular matrix. Extracellular. This is the definition. I hope you understood the definition. The antigens are present on the surface of cells or in the extracellular matrix. Against these antigens, the antibodies are formed. Then the reaction will take place. Now, see. Now, what has happened is the antibodies are present on the surface of the antigens are present on the surface of cells or in the extracellular matrix. Antibodies are formed and they got attached to these antigens. Okay. Now, after this attachment, three things can happen. After this attachment, three things can happen. One is opsonization and phagocytosis. Second thing is inflammation. Third thing is cellular dysfunction. Let us see how these things takes place. Okay, first one is opsonization and phagocytosis. Here what happens is this mainly takes place when the antibodies are attached to the antigens that are present on the surface of cells. Suppose now on these cells we have antigen. To these antigens, antibodies have been attached. Okay. Now what happens is this attachment will activate complement system. Suppose this is IgG antibodies, right? IgG antibodies. Okay, IgG antibodies. These IgG antibodies will activate complement system, right? Even when there are IgG or IgM antibodies, okay, they to activate complement system. What is happening here is the antibodies are activating complement system. So when the complement system is activated, what happens is some mediators during the process of complement activation, some mediator will activate, right? Okay, some like C3b. This C3b will act as further opsonization and activate phagocytosis. Okay, or otherwise during complementation, membrane attack complex can form. Attack complex forms. This complex destroys the cells. Okay, after activation of complement system, some mediators will form like C3b. This opsonize the cells and form and results in phagocytosis. Otherwise, membrane attack complex will form and this results in destruction of cells. Okay, the whole cell will get destroyed. Or otherwise, this complement system will result in, or sometimes even without the presence of, sometimes even complement system is not needed. These antibodies will activate NK cells, natural killer cells. By what? By antibody dependent cell mediated cytotoxicity. Antibody mediated antibody dependent cell mediated cytotoxicity. Okay. What happens here is, in antibody dependent cell mediated cytotoxicity, but suppose this is cell, on this cell we have antigen, right? To this antigen we have antibody. This antibody, this Fc portion of antibody has some receptors on the NK cells, okay, or otherwise NK cells as a receptor for Fc portion of antibody. This results in activation of this natural killer cells, which results in damage of, which causes damage to these cells. Okay, this is what happens after activation of complement system here. Okay, one is, after activation of complement system, some mediators will get released like C3b, which causes opsonization, then after phagocytosis, or otherwise membrane attack complex will form, which results in destruction of cells, or otherwise these antibodies will activate natural killer cells, which results in damage to the cells by the action of natural killer cells. Okay, and the same thing happens here, even here also. And the examples for this type of reaction is, examples are autoimmune hemolytic anemia, autoimmune hemolytic anemia, or autoimmune thrombocytopenia purpura, autoimmune thrombocytopenic purpura. Okay, these are the examples which uses this mechanism for the pathogenesis. Okay, then moving to inflammation. This inflammation will take place when the antigens are deposited in the extracellular matrix. Okay, when antigens are deposited in the extracellular matrix, then this inflammation will take place. Here what happens is, when antigens are deposited in the extracellular matrix, here also complement system will activate. This activated complement system will release some mediators like C5a, C3a and C5a. Okay, these mediators, like this C5a mediator, it has chemotactic function. It has got some chemotactic function for neutrophils and monocytes. Okay, it acts as chemotactic factor for neutrophil and neutrophils. Chemotactic function acts as chemotactic factor for neutrophils and monocytes. Okay, this C3a and C3-5a, they results in increased vascular permeability. Okay, they increase vascular permeability. What is happening here is, when there is increased permeability, these cells, neutrophils, monocytes, will come out of the vascular system, right? And as this C3-5a has got chemotactic function, this results in movement of these neutrophils to that site. Okay, and this activated inflammatory cells will release some mediators like proteases and free radicals. Okay, this recruited neutrophils or monocytes, they release some proteases and free radicals. This causes tissue damage. The examples of this mechanism include good posture syndrome, good posture syndrome, acute rheumatic fever, acute rheumatic fever, acute rheumatic fever, and pemphigus vulgaris, pemphigus vulgaris. Okay, pemphigus vulgaris. These are the important diseases which uses this mechanism for their pathogenicity. Then the last one is cellular dysfunction. Here what happens is, when the antibody binds to the antigen that is present on the cell surface, what happens is that this attachment will result in cellular dysfunction of the cell. It will result in dysfunction of this cell. Okay, there will be no phagocyte complement activation, there will be no inflammation, only dysfunction will take place, only dysfunction will take place. Okay, the examples include Graves disease, myasthenia gravis, pernicious anemia, and insulin resistant diabetes. Insulin resistant diabetes. Okay, so let me discuss it once again. So this type 2 hypersensitivity reaction will result when antibodies react with antigens present on cell surface, or when they are present in the extracellular matrix. This attachment will result in three effector mechanisms. One is opsonization, phagocytosis, the second one is inflammation, and third one is cellular dysfunction. In opsonization and phagocytosis, what happens is this mostly takes place when the antigen is present on the cell surface, right? Suppose this results in complement activation. Okay, when there is complement activation, there is formation of some mediators like C3b, which this C3b will cause opsonization and results in phagocytosis. Otherwise, there is one more mechanism. There is formation of membrane attack complex, which results in destruction of cells. Okay, then these antibodies can activate natural killer cells. These antibodies will activate natural killer cells, which results in antibody dependent cellular cytotoxicity. Okay, then coming to inflammation. Inflammation results when antigens are present in the extracellular matrix. Here what happens is there is activation of complement system, which results in release of some mediators like C3, C5A, C3A, C5B. Sorry, this is C5B. C5B. No, this is C5A only. C5A, C3A, and C5A. And these antigens, this mediator will cause chemotac function and results in recruitment of neutrophils and monocytes, which results in release of proteases, free radicals, which then results in tissue damage. And the third mechanism is cellular dysfunction. Here what happens is there is only dysfunction of this cell on which the antigens are present. Okay, and the examples are this Graves disease, myasthenia gravis, all these things. Okay, thank you for watching.